Frail elderly patients living in care homes are at particular risk from the harm that can be caused by the large number of medicines that they take. Our project aims to reduce this risk. Clinical medication reviews by our expert pharmacists aims to ensure that prescribing in this vulnerable group of patients is of high quality and safe for them.
To give a full, holistic, patient-centred medication review for patients who live in care homes in the Leeds West area.
Stopping any unnecessary medications that may be causing unwanted side effects, such as increasing a risk of falls. An example of this would be reviewing somebody's antipsychotic in a patient with dementia. It's making sure the patient's only receiving the minimum dose they need to manage their symptoms so as to reduce their risk of stroke from the antipsychotics.
Some patients, we've reduced the number of medicines so they don't have as many to take and they're only taking the ones that are really important to them. And some patients, we've stopped medicines which were causing them side effects, and that means that for some patients they're more alert and they can socialise more in the care homes. They've got a better appetite and generally they're feeling much better.
We are involved in a practice care home scheme with the West CCG, and I go into the 5 care homes within the Pudsey area once a week to support elderly care patients, do medication reviews, chronic disease management, support care home staff and develop care plans and hopefully avoid unplanned hospital admissions.
When the pharmacist has been to do their drug reviews, quite often I end up with quite a long list of maybe bloods to do to ensure that they're on the correct medication.
Through time, if different things crop up with the residents and they get new medication, I think it's important for them to be reviewed because the medication they've been on maybe for years might not quite suit them anymore with the new medication. So I think it's important for the residents that they have regular reviews.
I'm assured that the patient gets a proper, thorough medication review, and that the time that's spent is really useful and beneficial to the patient themselves.
They benefit everyone, do these reviews, because the residents know. We do have people who don't fully understand, but the ones that do, they feel safer knowing that a medication review is a phone call away. If they're not happy with anything, if they're on a new medication, we monitor them even more closely for any adverse effects.
This review is more proactive, and I was able to discuss with the pharmacist about the philosophy of care that we wanted to provide for people who've got dementia, and also to discuss about the real need of some of the medication. So as a home manager, it's more to have another professional to be able to speak to who specialise with elderly care.